So we're live, Kat.
We're live. We are. So we'll introduce ourselves then. I'm Karen Morgan. I'm the National Clinical and Education Lead for Lymphoedema in Wales.
Hi, I'm Melanie Thomas. I'm the Clinical Director. So we will be going live, or we are live shortly. So we're slightly early. We're waiting now for the next 4 minutes for people to join us. But while we're waiting, it is National Self-Care Week. So this is why we're doing this live this evening. So self-care, Kat, how do you self-care?
How do I self-care? So most people that work with me know that I love a bath on my own with the door shut and nobody coming in, just to relax and refresh and have a little bit of time on my own. I also really love walking my dog. That just gives me a bit of headspace. I think from a well-being point of view, that's really important. And then even though I moisturise my face, because that's most of the area that people can see, I take time to moisturise my legs and my arms and the rest of my body as well. And I think taking time for yourself in the busy world that we live in is really, really important.
Good. So for me, self-care, it's doing things that I like. So I love going to watch my son play rugby. So although that's quite stressful, it is a little bit of self-care, doing things with the family. I also talk a lot. So often driving home from work, even though I spent all day with her, we have a conversation and we offload of the day as to what we've heard, what we've learned, the worries that we get. And for me, that's a bit of self-care. And it's also being with the family, talking to my husband about the day we had, and the dog as well. Although I don't walk him as much as I should because I've got a bad hip, but that's another story. So, are we nearly there? No, we're 2 minutes before we start yet. Yeah. So now we've just got to ad-lib about self-care. I wonder how our patients self-care.
Yeah, I think it's really important that it works for you. I think the clinicians that you see, you only see for a short period of time. You're living with that condition, so you need to discuss with them how you can manage that yourself and keep yourself well. So that will be very individual for lots of different people. But yeah, discuss it with them and see what works for you. And remember that, you know, what works for one person might not work for another person. So it's really important to have that conversation. And I guess talk to other people with the condition as well, any chronic condition. As much as we try to support people living with lymphedema, we don't have it, so it's really important that you have those discussions with other people that are living with the condition as well. I know patients have told me in the past things that they've done to help them manage it, sort of putting the garments in the fridge overnight in the warm weather so that it's cool going on, and wearing their garments in the evening when it's too hot to wear them in the day. So trying to have their own plan that they can make sure that they keep themselves well, and how that fits into their routine.
That's good. So we are now 5 o'clock. This is when we were meant to go live. So for those of you who have just joined us, welcome. I'm Mel Thomas. I'm the Clinical Director in Lymphoedema Wales. I'm a physio by background, very proud physiotherapist. And Karen?
Yeah, I'm Karen Morgan. I'm the National Lymphoedema Clinical Lead and Education Lead in Wales, and I'm a really proud nurse, very passionate nurse. So yeah, good.
So self-care, we've already told you what we like to do, but I think an important point is, as you come to see us, we will give you lots and lots of information, and sometimes we give you too much, and we appreciate that as healthcare professionals, that we just want to give you as much as we can, and at that time you might only be able to take on maybe one of the things that we say, and for that we're really sorry. We really want to help you, and we just want to tell you everything that we know. So this is why, importantly, reels like this and going live gives us different opportunities to share the work that we know, and maybe then that you can pick and choose what you hear. So one thing that I really want to say, both Karen and I have been in lymphedema for too many years to share with you, but a long, long time. All of the advice that we give is pragmatic advice. Yes, we're researchers. Yes, I've done a doctorate. Yes, I know what's good evidence, but I'm also a realist in that, you know, it may be that we say you need to do this, you know, exercise 5 times a week for half an hour. That's the guidance. But in all reality, can we do that with the lives that we live? I find that extremely hard to do with family life, you know, as well as working full time. So we're going to be pragmatic, and the advice we give is real.
Yeah, and I think being a patient, we're all potential patients in the NHS. From a personal experience, I think it's really important to write down what's important to you. We've got our patient-reported outcome measures in Wales. It's really important that the therapist works with you on the outcome that matters to you. So I don't know if any of you are like this, but I'm very much, I'll forget what I wanted to say at the time that I go into the GP surgery or I see the therapist that I'm due to see. So take a list. Nobody's offended by a list. And as Mel said, we do try to give you everything. So try and get that consultation down to what's really important to you. The patient-reported outcome measures help that, but you go and direct that consultation what's best for you. That's really, really important. And if you can't cover everything and you need to be seen sooner, then you just speak to the therapist and arrange to be seen sooner to talk through that. Sooner. It's obviously the end of the day and I need more coffee. But that's okay. That's what keeps my self-care, let me tell you. A couple of coffees a day.
And good laughter.
Yeah.
Laughing, that's really good.
And that's good for your lymphatics, actually. Laughing. I remember somebody telling me, Liz Coveney, she might be watching, she's retired now, so she might not be, but actually a good laugh helps your lymphatics to work. So, you know, I think we're all a bit too serious a lot, too much of the time. You know, try and have a good laugh and have a good bookend like me and Mel have, so we can offload stuff too.
Yeah. Okay, so this is questions and answers about anything, ask us anything. Every Friday we've started doing Ask Us a Question. So obviously I started off on how often do I wash my garments. And you might have watched that, and it's been watched quite a few times, which is quite good. One of the questions that came back in was about fabric conditioner. We've been told we're not allowed to put fabric conditioner. Now, let's be honest and let's be realist. I've got a wash load waiting to go on. I can put my garments in there and I use a little bit of fabric conditioner. A little bit is not going to make a difference. So if it's once a week, your fabric conditioner goes in with the washing machine, in with your garments, do not worry about it, okay? So that answers that.
That's important. Sorry, Mel. That's important because, you know, I don't think people underestimate the burden of a chronic condition or living with a condition, and those added things that you have to do can really affect your self-care and how you do that the best for you. So you do the least with the best results, really. Really important. Okay, Aoife. Aoife's our wonderful digital marketing comms manager, and she's behind us, or in front of us. What's the question?
Okay, so we've got a question from Julia asking, would the lymphatic drainage massage help with severe lymphedema?
Yeah, I mean, any massage helps, okay? I always think back when the kids were little, or when I was younger, and if I hurt myself, the first thing that we do is we always rub it, and we rub the skin to take away that hurt, that pain. That's the same with massage. Hands-on care is so important. We all love a massage. You know, if Karen's having a particularly bad day and I'll rub her shoulders, that's really good. Now, lymphatic drainage, and there's lots of different types of lymphatic drainage, it can help your lymphedema, but so can other massage, aromatherapy massage, Indian head massage, reflexology, and there's lots more evidence coming out. So I would say definitely if you can have massage, then have massage.
Yeah, and so of course for severe lymphedema you need the other things as well. So the massage will work while the massage is happening. The compression, whether that's garments, wraps or bandaging, are constantly working when that garment or that compression therapy is on. But absolutely, massage, your immune system, your lymphatic system is your immune system. If you keep your immune system well and working, you're less likely to come down with problems like cellulitis, other infections, viral infections. So all of that will help. And remember, if you've got lymphedema, then that's impairing your immune system. So the more you can do to keep yourself well, the better. Because you're more at risk of those things that happen when your immune system is impaired.
Yeah. So massage, you can do it yourself. So if you had lower limb massage, you would start at the top, massaging upwards, massaging at the back and at the front, right the way as much as you can do. But skin to skin contact, massaging upwards is great. The only thing I would say is if you do have hairs on your arms or your legs, the last stroke that you do, go back down, because that pulls the hair follicles back down instead of coming upwards, that they then might go in on itself. So always massage, definitely do as much as you can. I know somebody's asked of, who would I see? What type of therapist would I see? So there are specific MLD therapists. However, I would suggest that you go and see, anybody who's qualified in a massage. There is nothing wrong with having aromatherapy massage or any sports massage. Again, you would tell them, I've got lymphedema. They can all do different types of massage. But start yourself. If you're looking on YouTube, use some creams, really massage into the swollen area and watch what happens. I can assure you, once you start massaging, the limbs that's swollen will start feeling lighter. We should all be massaging, realistically. Putting the skincare on and massaging, that would really help our tissues and our skin.
Yeah.
Okay.
Okay. So another question.
Yeah.
The question says, I'm going on Christmas holidays and I do not have lymphedema, but I've had cancer.
Okay.
Do I need a sleeve?
No. So you would only wear a sleeve if you've got lymphedema. If you're at risk of lymphedema, then you do not need to wear a sleeve. Now, if you were going on a long haul flight, then I would certainly recommend that you wear travel socks, because that's different. It's not going to take away the swelling, but it will take away, your risk of having a DVT, so a deep vein thrombosis. So when we've just come back from Canada, for those of you who've been watching us, we went to the ILF conference and we were presenting out there. We all had compression on when we were on that airplane because it was so many hours. So I would recommend to prevent a DVT, but if you do not have lymphedema, you do not wear a sleeve. Now, another question I keep asked is, I don't have lymphedema, I've had breast cancer, but I'm afraid of having a cellulitis. Do I need to take a prescription or do I need to take antibiotics with me to go on holidays?
Okay, so that is risk again. So if you haven't had a cellulitis before, your risk is low. The more cellulitis episodes you've had, the higher your risk. There's no evidence around taking them as a reducing the risk or taking them if you need them if you haven't had it. But if you have had a cellulitis and you've got lymphedema, then absolutely a rescue pack is the best way to make sure that you're not wherever you're going on holiday, you're not going to be in a foreign country and trying to explain what's wrong with you. So you can have a discussion with either your non-medical prescriber, there are a few in the team within Lymphoedema Wales, but also, or have a talk with the GP. And if the GP is concerned or wants to run something by us in relation to that, then we use Consultant Connect and they can contact us straight away and we can have a discussion to see whether we feel or support the fact that yes, it would reduce your risk and ensure that you could get on those antibiotics as soon as possible. But you don't need to take them if you haven't had a cellulitis, or certainly if you haven't got lymphedema. That there's no evidence for that at all.
Yeah. And if your GP doesn't want to write you a prescription, then there is always the option of a private prescription. So what that would mean is you would pay for that prescription for it to come. But as Karen said, you do not need it if you've never had cellulitis before, if you haven't got lymphedema and you're going on holidays, you do not need to have those antibiotics just in case.
While Aoife's looking at that, just to sort of say, your biggest risk with cellulitis is fungal infections. So what is really, really important is that you reduce the risk of any fungal infection. So any creases under your arm, under your breast, in your groin, in between your toes, those are the areas that can have a fungal infection that you don't know about. So making sure that those areas are kept dry, clean and moisturised well, and will again reduce your risk of that cellulitis even occurring in the first place. Yeah.
Great.
Okay.
Any more?
Yeah, we've got some. So another question says, I have breast edema.
Okay.
Am I allowed to wear underwire bras?
Most definitely. It depends how big you are. But if you've got any sort of breasts higher than a C cup, I would say definitely you need an underwire, because that's what gives the lift to the shape and the size of the breast. There is no risk of you wearing an underwire bra that's going to make your lymphedema worse. The important point is that you're in the right size bra. I think it's something like 8 out of 10 women were in the wrong size bras. So I would suggest, you know, if you haven't been measured recently, then definitely be measured. If you've ended up where you've got 4 breasts instead of 2, again, you need to be remeasured. That is probably too small. If there's any redness or cutting in around the middle or on the straps at the top, you probably need to be remeasured. But 100% you can wear underwire bras.
I think as well, if you lose weight or gain weight, we sometimes forget that maybe that will change. So you might be in too small or too big, as Mel said, and that's a risk because they're not supported. If you think about it, compression on legs or on an arm, we want that support and that compression, and that's what a good fitting bra does. So that's the risk really, if you're not, that you would get more edema in that area. Yeah.
Okay. Another question says, can I have any massage, or is it just MLD I am allowed?
Okay, so I think we've answered that a little bit earlier, but really you can have any massage.
Yeah.
Any massage that makes you feel good is good for self-care. Last week I went for a massage and I thoroughly enjoyed it.
Yeah.
Carla, you go often
I
for
do.
massages?
And I think if you've got tension in your tissues, in your muscles, then it's difficult for that lymphatic flow. So anything that loosens those muscles, any scar tissue, anything like that will actually help that flow. So any massage is great.
Definitely, yeah.
Okay. Another question that we have says, can I lift weight if I've got lymphedema?
Oh, definitely lift weights. We should all be lifting weights, especially women of a certain age, because we're more at risk of osteoporosis. We should be doing weight-bearing exercises and we should be lifting weights. Now, if you've got lymphedema, the evidence is there that tells you start lifting weights, because that will not only decrease the swelling, and even if you're at risk of lymphedema, it decreases the risk of lymphedema. So those who are active are far less likely to develop lymphedema than those who live a very sedentary lifestyle. So for those of you who've never used weights before, you can start off with tins of soup or tins of beans, and you start bending and straightening your arm. You could be lifting up and down, out to the sides and back. Just move your arms any which way you can, and you start with a little bit of weight. And then as you progress, you can start doing 1 kilogram weights, 2 kilogram, all the way up, you know, to 5 or more if you're really that strong. Now, if you've always lifted weights, then obviously you don't have to go back down to your cans of beans. You can stick at the weights that you've always used. There is no problem with that. And there's lots of evidence that talks about dragon boat racing. So that's actually when you're, you know, doing the rowing. They actually decreased the risk of lymphedema through lifting weights and activity. So 100%, get weights, move more.
Yeah.
Okay. Another question says, how often should I be seeing my lymphedema nurses?
Oh, that's a nice question.
Yeah, that's quite holistic, as I explained earlier. I don't know if it was before we officially went live, but actually that's dependent on the person. That's dependent on your outcomes and how you're managing. Remember that, you know, the lymphedema therapist should be supporting you to be able to self-care and manage your chronic condition, because they're not with you all the time. They might see you once or twice a year. But what we're trying to do in Wales is work on patient-initiated follow-up. So what that means is that they won't routinely give you an appointment. They will see you when you need to be seen. And that's really important, because I could say, right, I'll see you in 6 months, but everything's fine in 6 months. You might need to see me in 2 months. So that's the way we're going. So they might talk to you about, we're going to put you on a patient-initiated follow-up scheme. What that means is we're not discharging you. We're just not going to give you an appointment at this point, but you contact us as soon as you want an appointment. And it might be that I need 6 appointments this year and Mel only needs 1 because she's managing really well. So it just depends where you are in your self-care and management, I think. But again, I did mention PROMs, patient-reported outcome measures. So what is important to you and what is important to work collaboratively in shared care with your therapist on your priorities, basically. Really important. Yeah.
Definitely. And PIFO, and you'll hear all of our therapists in Wales talking about that, it is the way forward. And what we are really making sure is when you are put on PIFO, when you then ring up and say, I've got a problem, I need to be seen, that you were seen promptly, that you're not waiting months and months, you know, because you need to be seen there and then. So that's the big push.
Okay. Another question says, I have an acute episode of cellulitis, but I also take prophylactic antibiotics. Do I stop them?
Ooh, yeah, okay. So, yeah, really you shouldn't take 2 lots of antibiotics. So for that acute stage, the general rule, and this is important because there's not, you know, it's not a blanket thing, but the general rule is you stop your prophylactic antibiotics and you go on to antibiotics will treat that acute infection. Then you start back on your prophylactic when that acute infection is resolved. What is really a worry sometimes is that you don't finish that acute cycle and then you go on prophylactic and you haven't actually got rid of that acute infection. So a review by a prescriber at that point is really important. But yeah, the general rule is you start your acute antibiotics, then once that infection is resolved, you go back onto your prophylactic antibiotics. What we're trying to do in Wales is make sure that those patients who have had a few episodes of cellulitis have those acute antibiotics at home and they can start those if they need them, when they need them. Because remember, you are the expert, so you know. So the education around that and making sure that it is a cellulitis is key. But once we know that you're really well informed and, you know, we have that discussion and we know that you know your condition really well, then actually giving you those tools to keep you well is really important.
Yeah. And who knows more about lymphedema than you?
Yeah.
You are the experts, not us. We can advise you and give you some information, but you live with lymphedema day in, day out.
Yeah.
So we learn from you. So it's really important that you tell us how you feel, how lymphedema impacts on your life, and what we can do as therapists to try and decrease that impact on your life.
I think an important part of that as well is we are involved in research, but we want that to be driven by the people who are affected by it. So please get in touch with either your local service or us and let us know what's important to you, and then we can build some audit research around that area, because the evidence out there is quite minimal, really. And if we talk about garments, for example, wear your garments 8 hours a day, where did that come from? Who said to wear them 8 hours a day? There's limited research around things like that. So you are the key to this, to work with us so that we can build really good evidence that matters to people with a condition.
Yeah. And maybe that'll be one of our questions of the week. How long should I wear my garments for? So, and we'll answer that one. Okay.
Another question says, can my breast swell and not my arm?
Yes, most definitely. Breast edema, so you've had breast cancer, they've done a lumpectomy, so they've only taken where the cancer was out. Then what can happen is where they've done the surgery, it can start swelling. So you can end up with a very swollen breast where the operation was. So most definitely breast edema can happen. Some people don't have any arm swelling, but their breast is significantly swollen. Breast swelling can be really painful. Again, the treatments are, you know, a good supportive bra to actually compress that area, skincare, exercise, and we do something in Wales called the shimmy. And the shimmy is just reaching all the way forward and you shake everything about. And what that does is it just stimulates all of the lymphatics. And again, I'll tell you more about that on another day. But the shimmy does help. So yes, breast edema is a thing. Lymphedema can affect any part of the body. Head and neck, all inside in your mouth, your breast area, your genital area, your legs and your arms, your hands, your toes. It can affect anywhere. Yeah. Most common is obviously lower limbs and then upper limbs, but it can go anywhere.
Okay. Another question says, my hands keep swelling. What do I do?
Right. So we're having lots of upper limbs.
I was just about to say, Mel is the arm and upper body, I'm the lower leg, okay? So if you're thinking, Mel's answering all the questions, Mel's PhD is around breast. lymphedema. So I'm very much a leg girl. So if you want a leg question, pop it in so it doesn't look like it's all Mel. Yeah, okay.
So arms, hands. Okay, so the first thing I would do is open and close your hand. Exercise is so important, okay? So that's the first thing, up and down. Then I would actually moisturise, put in my cream on, always encouraging the flow up towards back of the arm, okay? So that's the other thing. And then it's compression. So we've got compression gloves, we've got all different things that can help. You can use kinesio tape to actually pull some of the fluid forward. But really, all treatments will work, but there isn't a natural cure for hand edema. The more we move, the more we exercise, that will help, is what I can say. Now, lots of people say, is there a cure? You know, Mel, I don't want to wear garments all the time. What can I do? Surgery may be an option. So in Wales, we are allowed to actually offer surgery for up to 40 patients a year, and that's lymphatic venous anastomosis, so LVA. So if you've had a cellulitis, or if you've got more just the arm or just the legs, then ask your therapist, could you be referred for a scan? And what we do is then we nearly lost you then.
Really lost you.
Put in the dye, and actually that will, I don't know if we've gone or are we still live?
Looks like we're live.
Are we live? We're still live. We're reliant on the internet. So then maybe surgery could be a plan. But for hand edema, compression, you may just decide to wear the compression in bed. You know, you could just put a glove on to go to bed, and in the day then you would wear sort of a sleeve from your knuckles. So yeah, definitely.
Okay, we're back. Yeah,
We're back.
All right. So another question says, can we use kinesiology tape?
Kinesiology tape,
Okay,
yeah.
on leg lymphedema, and if
Yes.
so, where and who can tell us how to do this, please?
Okay, so leg question, great. So yeah, you can use the tape. It's really important. Not all of the services provided on the NHS, sometimes you've got to buy it. And you can buy it relatively cheap on Amazon and places like that. Am I supposed to say any name? Well, anywhere on the internet. But no. I have no shares in anything. What I would say though is it's really important to do a patch test. Only speaking from experience, I'm really sensitive to the tape. So I wouldn't put on any area that's vulnerable or has lymphedema as a start. I would try it on a different area first. See if you're okay with it. You're not going to react to it or be sensitive to it. And then speak to your therapist about where you can get it, because it might be that they could procure them in, but generally it's patients will buy them, just because not everything is available on the NHS, unfortunately.
Yeah.
But it works for some people, it doesn't work for others. So definitely worth having a look at it and seeing if that's something that you could work together with your therapist on.
Yeah, and kinesio tape you can use underneath bandaging.
Yeah.
And you can use it underneath your compression garments or your wraps.
Yeah.
So, and it does support in that you're pushing or pulling tissues into a more normal position.
Yeah.
Some people it helps with pain. And also if you've got any folds of skin, sometimes we put the kinesio tape in the fold and then we lift it up. Then we compress over it. So suddenly we're trying to get rid of that fold.
Yeah.
But again, you need to talk to your therapist, and if some therapists don't know much about it, then obviously get them to get in touch with us. Yeah.
Okay. Another question says, my garments are way too long. Can I fold them over?
No. So if you think of an elastic band, if you think of a tourniquet, so your compression is graduated, it's equal, it's higher at the bottom and it works up. If you fold the top, you're creating a double band of that compression at that point, so it will tourniquet at that point. So if they are too long, and they might be that they're too long because you've lost some edema, because sometimes the width of the leg or the arm is taken up by the length. If your leg or your arm shape is improved, that's the time that you would be ringing the service and saying, these garments are too long, too small, too short, too big, whatever it'll be, I need an assessment. Because actually you can cause harm to yourself by folding it over. Yeah. So definitely have a discussion with the service.
Yeah. And the other thing to think about is we need graduation.
Yeah.
So that swelling finds its way up. Okay, so up the arm or up the leg. if you fold that garment over, suddenly you've got double the amount of compression just in that point. So the fluid can't find its way. So that's why it should never be doubled over.
Yeah. And you will see that a lot when your leg or arm shape is improved. Yeah. And when somebody asked about how often they should be seen, I think when you first start treatment, you need to be seen more frequently because things will change. You'll probably come to a status quo then, and then you'll need less follow-ups. So when they start a new treatment or they start a new garment or you start a new treatment, it's really important that you're followed up with that.
Okay, for our last question.
Last question.
The question says, I cannot cope with having only 2 garments. What are my options?
Okay, so you're given 2 garments and each garment is meant to last for 6 months. So you're given 2, technically they should last a bit longer than that. And this is what the companies suggest, that they last for 6 months. So I would have a discussion, if your swelling is static, I would discuss with your therapist as to, can I have a year's worth of garments, but I'll have them all now, and then they will last you for a year. So if you think about it, arm lymphedema, instead of having 2 garments for 6 months, you end up with 4 garments for a year. That's a bit like thinking you've got 4 bras, and 4 bras will last you a year. Better than only 2 bras lasting 6 months. It gives you more control, how often you're washing, have you got a clean one available. Obviously do not keep any compression garments for best. That's the worst thing that you can do. They all need to be worn equally, but I would definitely talk to your therapist to say, look, I'm doing great, can I have my year's worth of garments now? I'll contact you in a year unless there's an SOS or my arm's gone bigger or my arm's gone smaller. And that's exactly the same for your lower limbs. Yeah. Talk to your therapist, they will really help you. There are other reasons why some people like more garments too. Sometimes if people are in tights and they have problems with incontinence or they can't get to the toilet quick enough, we will always give you some extras because we know they're going to be washed far more. Children, so obviously we have children who have lymphedema and they're naturally growing. So they're given 2 garments and lo and behold they have a growth spurt and then they're too short. So we give some more. But talk to your therapist.
And I think we've talked about PROM, outcome measures. If that's a real issue for you, then that's what you need to be discussing in your appointment. So, you know, I work nights, I work 12-hour shifts. I need 3 pairs so that I can have them one dry, one on, one ready. Because it might be someone who doesn't work, who is fine with 2 pairs. But it's a discussion and it should be holistic around and a negotiation, a shared care with the therapist that you see.
Yeah. And again, you know, some people wear garments at night as well as the day. Yeah. You know, how do you cope then when you're using them all the time? So again, maybe we'll do a question about, you know, should I wear garments? Oh, I think you might have.
I'm doing that Friday. Should I wear garments at night? So tune in for that. I can't remember what I've said, so I might watch it to remember what I've said as well. I think it's mainly around, it's your choice. I'm very keen that it's you know, it needs to fit in with your lifestyle. Yeah. Who are we to say, we can give you the evidence, we can give you the research, but actually we need to listen. I said this the other day, we have 1 mouth and 2 ears for a reason. We need to listen to what's important to people and try and support them within what we can within the NHS, you know, negotiate that. So yeah.
So on that note, happy self-care week.
Yeah.
I hope you do some really nice self-caring things in the next couple of days. Karen and I are doing a very nice self-caring. We are going on holidays. See, we do like each other. With another colleague, we're actually going on a little cruise.
A self-care cruise.
A self-care cruise. So maybe we'll do a reel about what we've got up to on the self-care cruise in the future. But happy Monday evening. Hope you all have a nice evening and we'll be seeing you soon again.
And if there are any questions that we haven't answered, please send them in and we'll do them as questions of the week.
Great.
Thank you. Bye.